Good morning and welcome to the joint City Press Conference on COVID-19 emergency orders. First, we will hear from City of Urbana Mayor Diane Wolf-Marlin. Immediately following, we will hear from City of Champaign, Mayor Deb. City of Champaign Mayor Deborah Frank-Finan. Then we'll hear from the Director of Community and Government Relations at the University of Illinois at Urbana-Champaign, Robert Fleiter. And finally, last but not least, Champaign-Urbana Public Health District Administrator Julie Pride. Mayor Marlin, would you like to start, please?
Thanks everyone for being here. Just wanted to say that we have been working very hard over the past few weeks with our community partners, the University of Illinois, the City of Champaign, Champaign-Urbana Public Health District, county officials, to prepare for the reopening of campus and really to prepare our communities for this next phase of the pandemic. I firmly believe that as a community and as a campus, no one has a better plan in place than the U of I and our communities working together. I truly believe that. But the success of any plan ultimately, of course, depends on the participation and the behavior and the cooperation of the individuals in the community and folks coming to campus. And so, as you know, both cities of Champaign and Urbana have released emergency orders in the past 24 hours. They focus on use of face coverings in bars and restaurants, seated only for patrons, focus on the entry age for Class A establishments, which are bars. And then the emergency order Urbana released this morning also included the general requirement for face coverings. And we all know that one of the most important actions that an individual can take is to consistently wear a face covering when in public. It protects the community, it protects other people, and we're going to get through this pandemic through a collective effort, and that's what these emergency orders are geared toward. Thank you.
Thank you, Mayor. And next we'll hear from Champaign Mayor Deborah Frank-Finan.
Hello, thank you all for joining the press conference. I really want to emphasize the partnerships that have occurred in this community, which I think are going to be the difference makers as to, got some background noise, I'm not sure what that is, but I think will be the difference makers for why we are able to remain open and that our campus will be successful. And that really is because from the very beginning, the University of Illinois, the Public Health District, Urbana and Champaign have been working together on what our plans need to be and how to keep our communities safe and healthy and our students safe and healthy. We are lucky to be at the premier research institution that has developed testing protocols and an app and has a plan, in my opinion, second to none in the nation with respect to the return of students. At the same time, as a community, we have a responsibility as well to continue to do the things that Mayor Marlin has emphasized, to wear our face coverings, to social distance, so that we too can be a part of the success of keeping the students here on campus. We know that the next 3 weeks are critical, that we can rise or fall on what happens over the next 3 weeks. And so if you are concerned about the economy and you want things to reopen and you want the students to be here, then it's really important that you continue to follow the rules. With respect to the orders, we join Urbana with respect to the bars and restaurants and the seated capacity. That is best practices according to our public health district. With respect to Champaign bars and restaurants on campus, we have asked for outdoor seating only for these critical 3 weeks. And we have asked them to do that so that we have the opportunity then hopefully for our students to remain on campus, for our caseloads to be low, and for us to remain open through November, and to be in a better position as the weather gets poorer to maybe be able to allow people to come inside because our cases are low. So today the City of Champaign also issued a face covering ordinance in conjunction with Urbana and CUPHD. We have all worked together to make sure that that happened. And we will also be issuing later today a party ordinance that would restrict party gatherings in the campus town area and multifamily units to the people who live in the premises and no more than 10 additional people in an attempt to re-emphasize for the students that you know, even if you're not in the bars, you need to continue to wear face masks, to social distance, and to not have large gatherings.
Thank you. And before we proceed, may I remind all of you to please mute so background noise doesn't interrupt our speakers. Thank you very much. Next, we will hear from the Director of Community and Government Relations at the University of Illinois at Urbana-Champaign, Robert Fleiter.
Thank you, Bridget, and good morning, everybody. Honorable Mayors Marlin and Finan, it's good to join you here today. Also note that we have U of I trustee, Board of Trustee member Naomi Jacobson, I see on the chat here, so we're glad to see you as well. I'd just like to share some thoughts with you from the university. University of Illinois strongly supports the actions of Mayors Finan and Marlin and the cities of Champaign and Urbana. We also want to express our gratitude to them, their respective city councils, and the entire staff for their leadership during these challenging times. They've taken some amazing steps in our community, and we're certainly grateful to be working with them. We're also grateful for the leadership of Champaign-Urbana Public Health District Board members and its administrator, Julie Pride, and her entire staff. They've guided us, educated us every step of the way. And I think, as Mayor Finan mentioned, partnership is the key word here. The university, with its testing requirements, has taken some bold steps to ensure the safety of students, faculty, and staff, and hopefully the entire community. And the university also sees itself as an integral part of the community and believes it's fortunate to have governmental leadership that is engaging and responsive to the public safety needs of the community. Since the beginning of the pandemic, the university and its local government leaders have met regularly, developing joint strategies to keep the public safe, and this dialogue and partnership continues. And as is widely known, the University of Illinois scientists have provided guidance for the entire state, and through these efforts, state and local leaders have adopted a scientific approach for finding ways to lower the curve and reduce the incidence of COVID-19. We've appreciated the recognition of Governor Pritzker on these efforts. Chancellor Jones has ensured our state and local leaders will be kept up to date on the science, and we've encouraged them to consider the suggestions made by scientists at the university. Our leaders in Champaign, Urbana, and Champaign County have listened, and they've asked questions, and they've made informed decisions. By taking decisive action to minimize opportunities for COVID to spread, Champaign and Urbana are adopting the same practices that helped Illinois flatten the curve early on, relative to other states that did not appear to take decisive action as early. In our judgment, early and decisive action will benefit the community and our local economy in the long term. And Chancellor Jones has valued the strong and continued partnership of our local community leaders, and we will continue to share the results of our modeling and research that we are hopeful will be informative to our local leaders. And I'd just like to thank you for the opportunity to participate in today's Zoom meeting.
Thank you, Bob. And finally, we will hear from Champaign-Urbana Public Health District Administrator, Julie Pride.
Hi, thank you for the opportunity. Also, thank you all for being such amazing community partners. Like everyone has said, This is not something that one agency, one university, one city, one county can do. It takes a lot of effort, and it takes people who are listening to the science, asking questions, trying to understand what we are doing, what the mitigation strategies are, and how those work. So I just wanted to talk briefly about the code change to the Illinois Public Health Control of Communicable Diseases Code. That has gone into effect already, and it's also, it is intended, it's statewide, and it's intended, of course, to prevent this community spread of COVID-19. This code change has been through JCAR, and it has the full effect of law. What it says basically, and this is a summary, is any individual over the age of 2 who is medically able to do so needs to wear a face covering when they're in public if they cannot maintain the 6-foot distance. This also says any business, service facility, organization that's open to the public has to have employees and customers and any other individuals going in there also, must wear face coverings. And this also includes public schools, whether they are public or private, preschools, institutions of higher learning, and daycares, vocational programs. All of those have got to do the face coverings as well. And just to also reiterate, gatherings of 50 or more are prohibited. And that is not just a blanket 50 people. It could actually be less if the space you're talking about is smaller. So it's a maximum of 50 individuals. What is new about this is that now there is enforcement associated with it. And while the vast majority of our county is doing a great job with this, there are places that, for whatever reason, are not. So the enforcement piece of this, which is new, and the enforcement can be done either by public health, police officers, sheriffs, other employees of local and state agencies. But it will require basically a 3-step process: a written notice of noncompliance, order to disperse, and then it can be fines up to $2,500. We certainly are hoping that we do not have to use those anywhere in this county, that people will just understand the importance of these guidelines and their importance to continuing what we want to do, and that is keep the university open, keep businesses open, and keep us moving forward. Thank you.
Thank you. Next, we'll field questions. Please state your name, raise your hand, and then state your name. And if you would like to direct the question to a particular individual, that's fine, or you can just field a indirect question, and then we can take it from there. Okay, Andy Olson?
Hi, can you guys hear me?
Yes, we can.
All right. My question is for Julie Pride, and it's about that mask mandate, and you talk about the enforcement of it now. I guess the question is, why now did the decision come down to where it was decided that it needs to be enforced, at the level of law?
Well, because it works with a lot of the community and a lot of the state, but it does not work everywhere. And there are places, it's not the case in Champaign County, but it is the case outside of Champaign County that places are, the health departments are getting no support for in doing these type of measures. And so they're seeing, community spread, and they're continuing to see very preventable outbreaks, and they don't have the support. So I believe that the state put this in effect so that the health departments can enforce this as well, just like we can other things such as isolation or quarantine. So locally, we're putting it in for the same reason. While the vast majority of businesses and individuals are doing what they need to do to prevent community spread, not all are doing that. So, where we've used basically carrots forever for this, and it works for most people. Unfortunately, sometimes you need the stick, which is a law with a enforcement piece.
I'd like to add with respect to the individual enforcement, we actually had businesses that were requesting that we consider that because as the state law left it, the business was responsible for the actions of all of the patrons, but oftentimes had very little ability to enforce that. When you have a young 18-year-old standing at the door of a business establishment trying to pass out masks and asking people to wear them, and people are refusing to do it and yelling at her or him and walking into the business anyway, it doesn't seem fair to have the only enforcement tool be enforcement against that business. And so this makes it an individual responsibility, and allows for the businesses then to call if there is an issue.
Thank you, Julie and Mayor Fine. And if it's okay, Bridget, I do have one more question.
Well, does it relate to this? Because we do have other people. So
Sure, I can wait in line as well.
I'll just take you next. But first of all, I would like to, Alderman Lau, would you like to ask a question, please? You need to unmute at your lower left.
Hi, Bridget, thanks. I was curious, we've watched what's happened at places like Notre Dame and UNC where they opened up and then very quickly, had to pivot and go back to online. I wasn't as familiar with what their plans were on their campuses as I am here, but I'm wondering if we as a community, what are we looking for where that decision might be made prior to fall break?
Okay, I can take that if that's okay with everyone. Because I was actually just talking to someone about this. And I am saying this with the utmost sincerity. If this can happen, if a university can open during a pandemic, it will happen at the University of Illinois, or it won't happen. A lot of places, a lot of colleges and universities went in and opened when there was too much community transmission. We've done a pretty good job of keeping our community transmission low and our resources meaning healthcare resources, stable. So we've already got that going for us. But what the University of Illinois also has, which is something that is just not available other places, and it is the unbelievable testing capacity. They have that coupled with the app, the Rackwire app, coupled with all of their policies and procedures and all of the community support, because we all work really well together. So unlike a lot of places who were just sort of developing a plan and jumping into it, that's not what's happening here. This plan has been in development for specific to COVID since March. It's been, January actually, been working on it. And there are just more resources. This could not be done without all of the testing that they're able to do. It could not be done with that. It also probably could not be done without all of the community testing capacity that we have here. So I think that with a lot of these places, they just did not have the resources in order to do that. What we have had during this time is we have the ability to do all the testing that's needed and all of the contact tracing, isolation, and quarantine services that are needed. And most places just don't have that. So that truly is the difference.
I understand that, but I also know that for people who don't have to be on campus, they don't have to get that testing. I mean, I guess I'm just expressing concerns certainly that I have, and I know other community members have, who aren't on campus and aren't getting those, twice weekly.
Okay, testing. I should probably explain what the testing is. So the testing is really just a public health tool. It allows people to be identified as soon as possible that they are infectious and then put into isolation and quarantine, and that then stops additional outbreaks. We do have far more testing capacity because we have the mall site here and the faster turnaround time due to the Carl's lab, which has been expanded and supported with help from the U of I as well. So we have that capacity. What we're looking for constantly at public health is where do we stand? Not so much just a number of how many people test positive. Are they testing positive in a timely manner that we can then get them into isolation and quarantine? Do we have enough staff to do that? And we do. And then also, the other issue is our hospital capacity. That only slightly, that has to do with our community, but it also has to do with the surrounding communities that feed into those hospitals as well. So that is going to be one of the contributing factors that we're really looking at about when to start making any other type of decision.
Great. Thank you so much for the amazing work that you're doing. I really appreciate it.
Andy, would you like to ask your question?
Yes, thank you. I appreciate it. This one is for Mayor Finan, and it's just kind of circling back to the party ordinance as it was put. I guess my question is about the enforcement of that. Is it going to rely on community tips? Is there going to be officers who are checking on this? And then if Mayor Marlin can go afterwards, if this is something that Urbana is also considering as well.
So, I mean, some of it will be community tips. You might not be surprised to know that we are already receiving emails from some U of I students' parents telling us, my kid is planning a party at X and such location on this date. And so we have a little bit of that going on. But we will, we recognize, particularly the first weekend or so, that enforcement is going to be key, that we're going to need to be on top of it so that students understand that we are taking it seriously. We have been partnering with UIPD, Urbana Police, and also with public health. And so we will have a variety of different people out working on enforcement. But the students should be forewarned that we are taking it seriously. And whether that's a tip from their next door neighbor or the owner of their apartment complex, we are going to be taking it seriously. And I don't mean to put Bob Fleiter on the spot, but as I understand it, because we now are going to have a ticket process relating to the party enforcement, once the ticket is issued, that then can be referred to the University of Illinois for the potential of university discipline, which is really the kind of the larger tool to get the students to take this seriously.
Mayor Marlin, I think Andy wanted you to. Andy, did you have a question for Mayor Marlin as well?
Yeah, the only follow-up I had is if this is something Urbana is considering as well for the complexes that are located in that city.
We are considering it. We have not made a final decision yet, but I will note that it's not just students for whom parties are a problem. We hear on a pretty regular basis of backyard parties, anniversary parties, birthday parties. I got wind of one coming up for something like 200 people at a church. People have to understand that which of course now would not even be allowed under state law, but people have to understand that this is one of the most consistent ways to spread this disease, and it's one of the riskiest behaviors to be engaging in, and it's a community-wide issue.
All right.
But at this point, we haven't drafted one yet.
Does anyone else have any other questions for our panel here?
I do.
Paul Hickson?
Yes. I appreciate what everybody is doing, and I certainly agree with what Julie Pride was saying, that we have an unusually rich community set of assets, and I appreciate the fact that the university and both cities and public health are pulling together to do all this. As I read the News Gazette story this morning, though, it seemed to me that the limited attendance at indoor restaurants was limited to the campus area. And given that we have so many students who are able to have cars. Why was that not extended to the broader Champaign-Urbana community?
From my perspective, the initial discussions centered around particularly campus bars. As you can imagine, there is a lot of congregating and potential for spread there. The discussion then morphed into restaurants. What we have agreed to is that these are the most important. We need to get this area under control. We will be looking at enforcement and having watchful eyes on the rest of the city. If it looks like we're going to have significant issues in other areas of the city, we would consider an expansion. But as you can imagine, the reality for these mostly small business local owners is that they are barely surviving, and they are not only employing, it's their family's livelihood, but they are employing many people throughout our community. And we are trying to do the least amount of economic damage to people who are really struggling to keep their businesses going during this, while still recognizing that we have to be as safe as possible with respect to COVID. These are not easy decisions. It's a balancing. This is where we landed after a lot of discussion and work with, the U of I modelers and with public health. It may not be perfect, but it is at least our beginning steps in trying to make a difference.
And to be clear, the restaurants are still operating under the, the phase 4 guidelines. They're still limited capacity wise, and most are doing a lot of outdoor seating and that type of thing. So those guidelines are still in effect. So nothing has changed with that. They still can't have, the places back to full capacity yet. And that's probably not going to change until the pandemic ends.
We also, I would note that, like Urbana, we extended our order that was a campus town order. So we're requiring, everybody be seated. All patrons must be seated, standing area. That was a public health request. We are not allowing under 21 after 9 o'clock at night. So we are doing some things in the rest of the city to also try to maybe curb the enthusiasm of the students.
And our emergency order covers all restaurants and bars in the city of Urbana as far as requiring patrons to be seated indoors and outdoors, whether or not they serve alcohol.
Thanks, everybody, for that's helpful. Could I ask one other question, follow-up, and that is, I understand that a lot of this discussion was prompted by Eric Jacobson's model that he presented to the cities and to the university. Could I ask if it would be possible for Eric to comment on whether drawing the line at campus bars as opposed to all bars in Champaign-Urbana, and the same with restaurants, was that where his research had suggested the line should be drawn?
So Paul, before we do that, and Bridget, it's Bridget's meeting to moderate, but I want to be clear that although I was glad to have Eric's research, the research that I was working with primarily was the SHIELD team at the University of Illinois. That's okay. The group that has been working with us, and that is a slightly different group of people.
Okay, I can comment that essentially what our model showed is that there would be beginning about now, a surge in the viral load in the community and lasting for about 3 weeks. And the reason it would only last that long is because of the university's testing regimen. We didn't show to the cities and to public health and to the university, but actually there was another part of the model that showed what would happen if you didn't have the university's testing regimen, and what was going to happen, what would have happened would have been exactly what did happen at University of North Carolina, at Michigan State, at Notre Dame. There would be a surge, but it wouldn't be cut off, and it would, in fact, be out of control. So, so actually what happened at UNC, the difference between what happened at UNC and what all of us think and hope will happen at Illinois is actually really pretty predictable. So we will have a surge. There's no question. There's almost no question about that, because people who are coming into town are coming from populations. They've been in populations that are carrying a higher viral load. The more constraints we put on, the smaller that surge will be. But the duration is not so sensitive to these constraints. The period of 3 weeks is about right. By about Labor Day, or maybe a little bit after that, we should be back at a pretty good place. That's what the model projects. And I think our modeling, I've talked with the university modelers, and we've presented our results. We've drawn slightly different graphs. We've interrogated the models slightly differently, but essentially they're based on the same assumptions, and they essentially paint the same picture. I should add that really the work on that was done by Santiago Nunes Corrales, who's also on the call, who's a graduate student, really terrific. So yeah, everything that I think, and I do understand, we actually, in our modeling, did a little bit of economic modeling appended to the epidemiological modeling, and it's a terrible situation because there are no solutions. There are only trade-offs between economic costs and public health benefits, and you just have to do the best that you can do.
Thank you, Mr. Jacobson. Taylor Deckert, did you have a question? You need to unmute first, please.
Yes, mine is regarding the rapid testing. So looking at the wait times and that first test that students take when they step on campus, what is that wait time from when they take the test, complete the test, and when they get their results, and where are they going while they wait for that test?
So I think I should probably answer that one from a university standpoint. And Julie, if you have some additional thoughts on that, please feel free to weigh in. But when the student takes the test, of course, there's distancing every step of the way. They go in, they present their ID. Same with employees. In my case, as an employee, I present my ID card. I also have the app downloaded, and you're told that you'll have your test sometime between 24, 48 hours. But without fail, I've had mine in less than 24 hours. I've taken it 3 times. Twice it's been within 4 or 5 hours. It's come back. Obviously, there's increased volume right now with students and faculty coming back, and with the requirement that we need to have these tests in order to go into our buildings. But it's been pretty quick, and if you have your app, you actually have the result come back, and it's reported back to you on your app in a very confidential manner. So I don't know if that answers your question, but it's certainly a test that I think people have worked very hard on, trying to make sure that we could facilitate it. We also have, I believe it's 17 locations on campus where people can be taking the tests. It's, so far, university has been able to facilitate the necessary testing that's been required, and it's only going to ramp up, of course, in the next few weeks.
Yeah, but I think if your question is, are they testing and then going somewhere where they could be exposing a lot of people? The answer to that is no. They, are told at the time of testing what they need to do and to wait for the results. And everybody is to assume that not only are they positive, but everyone they come in contact with is positive. So again, the good thing about this testing program is not just the testing itself, but all the other things that are going along with that. So again, you're never going to prevent someone who has COVID from coming into your business, your school, your classroom, the campus, whatever. But what you can do to prevent outbreaks is to make sure that you're maintaining the mask wearing and the distancing, because that is really the key. So it's a combination of the testing, the quarantine, contact tracing, isolation, and then the mitigation strategies, or they're also called non-pharmaceutical interventions, but wearing a mask and staying at least 6 feet away from other people. So that's pretty much all those pieces are in place.
And Julie, if I might add, one of the requirements is that students and faculty staff be tested twice a week.
Mm-hmm.
So, for example, I was tested on a Wednesday, and I think by Saturday or Sunday, my app basically said, you need to get tested again. It said you're sort of it tells you that you are at risk, and it defaults to that. Key is that if I were to show up and try and get into a building without that test at the appropriate interval, I could not get into that building. So it really does, the process and the program with the frequent testing and the combination of other things that Julie mentioned really is one of the keys to being able to monitor this and provide the level of information that's necessary to everybody involved.
Thank you.
You need to unmute, Bridget.
Yep. Sorry about that. Do we have any other questions? Oh, Ethan Simmons. Did I pronounce your name right? Simmons?
It's Simmons, but thank you.
I'm sorry.
No, it's all good. I just want to thank everybody for all the great work you're doing. And I guess this question is for Bob or Julie, whoever can answer it as best they can. But I was just wondering, do we know what figures or percentage of students that have returned have tested positive for the virus? And then what is being done for them afterward? Are they going in some of the quarantine areas at the university, or are they being asked to be sent home?
Well, I can start by talking about that. I can tell you that the numbers that are coming back, the volume of testing is staggering. It's really amazing how much testing is being done. And the cases are, so far have been, very small number of cases that we're getting. And again, as soon as they are found to be positive, then they are put in isolation. And that can be done by a variety of ways. I guess if they're new to campus, they may be sent right back home, with their parents, if their parents brought them. But they can also be put in isolation in U of I housing. They have set aside some housing for that. And then, if there were to be none available, then CU Public Health District could also work with, through our resources, to get people into isolation in hotel rooms.
Did you want to answer to that, Bob, or no?
Yeah, and I think that was a great answer. I do not have any specific numbers in terms of positive tests. I think that typically would go through the normal process through the public health channels, and so we just don't have anything that I could share at this time. Of or that I even know about at this time.
Are there any other questions? Well, if that's it, we will wrap this up. And I would like to personally thank Mayor Marlin, Mayor Finan, Bob Fleiter, and Julie Pride for fielding questions today. I also would like to thank Jeff Hamilton of the City of Champaign for helping me, and also our own station manager, UPTV6, Jason Liggett. So if you also have any other further things you want to find out, you can email me, and then I will make sure it reaches the appropriate person. So thank you very much.